Do you ever wake up in the morning and your legs feel heavy, like there's lead inside them? Maybe your ankles are a little puffy. Maybe you've had a cramp jolt you awake at 2 in the morning. Or maybe your legs just ache in a way that wasn't there 10 years ago. If any of that sounds familiar, I need you to pay close attention to the next few minutes, because what I'm about to share could genuinely change the quality of your sleep starting tonight. You see, most people focus on what they eat, how much they exercise, or what medications they take when it comes to circulation. But almost nobody talks about what your body is doing for 6, 7, 8 hours every single night while you're asleep. The position your body is in while you sleep either works with your circulatory system or quietly works against it. And after the age of 60, that difference becomes enormous. I'm Dr. Alan Mandell, and today I'm going to walk you through the 5 sleeping positions that are specifically designed to boost blood flow to your legs. Backed by physiology, used by medical professionals, and available to every single one of you tonight for free. Stay with me through all 5, because position number 4 surprises almost everyone, and it may be the one that helps you the most. Before we get to the positions, let me take just a moment to explain why this matters so much, especially for those of us over 60. Your heart is an incredible pump. Every single beat, it sends oxygenated blood out through your arteries. But here's the challenge. The legs are the farthest point in your entire body from that pump. Think of it like a garden hose. The closer you are to the faucet, the stronger the water pressure. The farther away, the weaker it gets. Now add to that the fact that veins, which carry blood back to the heart, have to work against gravity. They rely on tiny one-way valves and the pumping action of your leg muscles to push that blood upward. As we age, those valves weaken, muscle mass decreases, and circulation slows down. The result? Blood starts to pool in the lower legs. And that's when problems begin. We're talking about varicose veins, those twisting, bulging veins that appear in the calves and thighs. Chronic edema, swelling in the ankles and feet that doesn't go away. Nighttime leg cramps, painful, sudden contractions that wake you from a dead sleep. Restless leg syndrome, that irresistible urge to move your legs that makes it impossible to relax. Peripheral neuropathy, tingling, numbness, or burning in the feet. And in serious cases, deep vein thrombosis, or DVT, a blood clot that can become life-threatening. These are not just inconveniences. They are real medical conditions, and they are extraordinarily common in people over 60. But here's what I want you to hold on to. Sleep posture is one of the most powerful, most underused, most completely free tools we have to fight back. When you sleep correctly, when you position your body in a way that assists your venous return, your heart doesn't have to work as hard. Your blood moves more freely, and your legs wake up feeling better. So let's get into it. 5 positions. Let's count them down. Position number 1, legs elevated. This is the foundational position, the gold standard, and if you do nothing else after watching this video, I want you to try this one tonight. What it looks like: you lie on your back, you place 1 or 2 firm pillows, or ideally a wedge pillow, beneath your calves and ankles so that your legs are raised somewhere between 6 and 12 inches above the level of your heart. That's it. Simple. but the physiological impact is extraordinary. Why it works? When your legs are level with, or lower than, your heart, blood has to fight gravity to return through the veins. The venous pressure in your lower legs can increase significantly just from lying flat, and even more from sitting up during the day. But the moment you elevate those legs above heart level, something beautiful happens. Gravity becomes your ally instead of your enemy. Blood flows downward, back toward the heart, effortlessly. Venous pressure drops. Fluid that has been pooling in the tissues of your ankles and calves starts to drain. The specific benefits? Visibly reduces ankle and calf swelling, often within one night. Reduces the pressure on varicose veins and helps prevent new ones from forming. Decreases the risk of blood clot formation in the deep veins. Improves lymphatic drainage, reducing puffiness and inflammation. Many people report deeper, more restful sleep because their legs are no longer throbbing or aching. How to do it correctly? Use a wedge pillow, which you can find at most pharmacies or online for under $30, or simply stack 2 firm regular pillows beneath your calves. The goal is calves and ankles elevated, not just the heels. If only your heels are resting on the pillow and your calves are dangling, you're actually creating a pressure point that restricts blood flow. The entire lower leg needs support. The ideal elevation is about 6 to 12 inches. Going higher than that can cause some people to feel lightheaded or uncomfortable. Who benefits most? People with chronic leg swelling, varicose veins, venous insufficiency, anyone on their feet all day, and those who sit for long periods. One caution: if you have severe acid reflux or gastroesophageal disease, lying completely flat may aggravate your symptoms. In that case, position number 4, which I'll cover shortly, is actually a better fit for you. Position number 2, left side sleeping. Now let's talk about side sleeping, and specifically why the left side is so much better than the right for circulation. What it looks like. You lie on your left side with your legs loosely extended or very gently bent. Place a pillow between your knees to keep your hips, spine, and pelvis in neutral alignment. Why left, not right? This comes down to anatomy. On the right side of your body runs a large vessel called the inferior vena cava, or IVC. This is the primary highway that carries blood from your lower body back up to your heart. It's a massive, high-volume vessel, and it sits just slightly to the right of your spine. When you sleep on your right side, the weight of your abdominal organs, your digestive tract, and the general compression of your body presses down on that inferior vena cava, restricting venous return to your heart. When you sleep on your left side, that pressure is relieved. The IVC runs freely. Blood flows upward from your legs more efficiently. Your heart receives better venous return and doesn't have to work as hard. Research in cardiology has confirmed that left-side sleeping reduces the workload on the cardiovascular system, which is particularly meaningful for those of us over 60, when the heart may already be working harder than it used to. Additional benefits beyond leg circulation. Reduces acid reflux and heartburn, very common in this age group. Supports better kidney function and lymphatic drainage. Reduces snoring for many people. Can reduce blood pressure over time when practiced consistently. The pillow between the knees. Why it matters. Without that pillow, Your top hip rotates downward across your body during the night. This twists your pelvis, compresses the sciatic nerve, and, importantly for our topic, can crimp the blood vessels that run through the hip and thigh area. The pillow keeps everything aligned. Use a firm, supportive pillow, not too thick. About 4 to 6 inches works well for most people. Who benefits most? People with high blood pressure, type 2 diabetes, chronic swollen ankles, pregnant women, and anyone with varicose veins or venous insufficiency. One note: if you have a left shoulder injury or rotator cuff problem, sleeping on the left side may aggravate it. In that case, alternate nights or use a slight reclined position. Position number 3, modified fetal position. Almost everyone instinctively curls into a fetal position to sleep, and the truth is, done correctly, it can be quite beneficial for leg circulation. Done wrong, it can actually make things worse. The key word is modified. What it looks like: you lie on your side, preferably your left, and bend your knees to roughly a 30 to 40 degree angle. Your body forms a gentle, relaxed curve. Your shoulders should be stacked, not rolled forward. Your neck should be in neutral alignment, not bent sharply downward. What it does not look like: you are not pulling your knees up to your chest. You are not wrapping your arms around your legs. You are not curling your chin to your knees like you're trying to make yourself as small as possible. That tight, fully curled fetal position, which many people sleep in without realizing, actually compresses the blood vessels in the hip flexor and popliteal regions, the back of the knee, significantly reducing blood flow to the lower legs. Why the modified version works. A gentle bend in the knees does 2 things. First, it takes pressure off the lumbar spine, which helps people with spinal stenosis or degenerative disc disease sleep more comfortably. Second, and this is important, it keeps the femoral artery and the popliteal vessels in an open position, allowing blood to move freely through the thigh and into the calf. Additionally, this position is excellent for people who suffer from sciatic pain that travels down the leg. The gentle flexion opens the neural canal slightly, relieving pressure on the nerve roots. Benefits specific to leg circulation: reduces tingling and numbness in the legs overnight. Helps people with peripheral arterial disease maintain better flow through gentle positioning. Reduces morning stiffness in the hips and knees. Particularly beneficial for those with spinal stenosis, a very common condition after 60. Pillow support. Use a pillow between the knees, same as position 2, and make sure your bottom arm is extended in front of you rather than tucked under your body, so you're not compressing the brachial vessels in the shoulder. Who benefits most? People with sciatica, spinal stenosis, hip arthritis, numbness in the feet, and peripheral neuropathy. Position number 4, slightly reclined. I promised you a surprise. Here it is. For many people, particularly those with chronic venous insufficiency, restless leg syndrome, or a combination of swelling and back pain, the best sleeping position isn't lying flat at all. It's sleeping at a slight incline. What it looks like: you sleep on your back at an angle of roughly 30 to 45 degrees. This can be achieved with an adjustable bed if you have one. If you don't, a specially designed wedge pillow set where one wedge supports your torso and a second supports your legs, can replicate the same effect beautifully. Some people achieve this by propping themselves with 2 or 3 firm pillows behind the upper back and head, though this is a less precise method. Why it works, and why it surprises people. Most people assume that only lying flat is restful. But for the circulatory system, a mild incline creates a very specific benefit. It reduces venous hydrostatic pressure throughout the entire body, not just the legs. Imagine the water pressure at the bottom of a tall column of water versus a shorter, angled column. The angled column has less pressure at the base. The same principle applies to your venous system. By sleeping at 30 to 45 degrees, you reduce the pressure inside the veins of your lower legs, which allows them to drain more effectively, even more efficiently than lying flat. The restless leg connection. Restless leg syndrome is closely linked to venous insufficiency. When venous pressure in the legs is high, the sensory nerves in the tissue become irritated, producing that classic crawling, restless sensation. Sleeping at a mild incline reduces that venous pressure, and many people find that their RLS symptoms decrease significantly within a few nights. The leg cramp connection. Nighttime leg cramps are often partly caused by reduced perfusion to the muscle tissue during sleep. The reclined position supports more continuous blood flow through the calf muscles, reducing the likelihood of that sudden, agonizing cramp. Bonus benefits for the over 60 population. This position is also excellent for sleep apnea, extremely common after 60. It keeps the airway more open than lying flat. It reduces acid reflux. It eases lower back pain. It reduces snoring. Basically, if you are someone who struggles with multiple issues at night, leg discomfort, back pain, reflux, and breathing, this single position may address all of them at once. How to get the angle right. Too little incline, under 15 degrees, provides minimal vascular benefit. Too much, over 60 degrees, strains the neck and lower back. The sweet spot is 30 to 45 degrees. If you're using pillows, feel free to experiment over a few nights until you find what feels natural. Who benefits most? People with chronic venous insufficiency, restless leg syndrome, frequent nighttime leg cramps, sleep apnea, GERD, and lower back pain. Essentially, a very large portion of the population over 60. Position number 5. Back sleeping with proper support. Our fifth and final position is one that most people think they already know how to do. They lie on their back, close their eyes, and call it a night. But there's a world of difference between simply lying on your back and doing it correctly. And that difference directly impacts how well your blood circulates while you sleep. What it looks like. You lie flat on your back. Your head rests on a pillow that is relatively low, just enough to keep your cervical spine neutral, not propped up so high that your chin is forced toward your chest. Beneath your knees, you place a small, firm pillow or a rolled-up towel, creating a gentle, supported bend of about 10 to 20 degrees. This is the key detail that most people skip. Optionally, if you have lower back discomfort, a small lumbar roll or a thin pillow placed beneath the natural curve of your lower back provides additional support. Why the pillow under the knees is everything. When you lie completely flat with your legs extended straight, the hamstring muscles are pulled taut. This creates a posterior pelvic tilt, which flattens the lumbar spine against the mattress and more importantly for circulation, causes a subtle compression of the popliteal vessels behind the knee. The popliteal artery and vein run directly behind the knee joint. When the leg is in full extension under tension, these vessels experience increased resistance. Blood flow to and from the calf is subtly reduced. A small pillow beneath the knees releases that tension. The hamstrings relax. The knee joint opens slightly. The popliteal vessels decompress. Blood moves freely. The full distribution benefit. Proper back sleeping distributes your body weight more evenly than any other position. When weight is distributed evenly, no single area of the body bears disproportionate pressure, meaning no vessel is being compressed, no nerve is being pinched, and circulation can operate optimally throughout the entire lower body simultaneously. Additional benefits. Ideal for people with hip or knee arthritis. No joint is bearing weight. Reduces facial puffiness and lymphatic congestion. Eliminates shoulder compression that can occur with side sleeping. Supports spinal alignment throughout the night, reducing morning stiffness. The mattress factor. For this position to work well, your mattress matters. A mattress that is too soft allows your hips to sink, creating a hammock effect that strains the lower back and restricts pelvic circulation. A mattress that is too firm creates pressure points at the heels, calves, and sacrum. A medium firm mattress is generally optimal for back sleepers over 60. Who this is best for. People with hip or knee arthritis, those without sleep apnea, people managing chronic lower back pain, and those who want comprehensive full-body circulation support. One important caution: if you have untreated obstructive sleep apnea, meaning your airway collapses during sleep, back sleeping can worsen the obstruction. Please address your sleep apnea first, whether through a CPAP device, positional therapy, or consultation with your physician. Once your airway is managed, back sleeping can be reintroduced safely. All right, 5 positions covered. But before I let you go, I want to give you several additional strategies that will amplify the benefits of whichever position you choose tonight. 1. Ankle pumps before bed. 2 minutes. Before you lie down, sit on the edge of your bed and do ankle pumps. Simply flex your foot up toward your shin, hold for a second, then point it down. Repeat 20 to 30 times on each foot. This activates your calf muscle pump, the venous pump in your lower leg that helps push blood upward. Starting your sleep with that pump freshly activated makes a real difference. 2. Take off your compression socks. I know this sounds counterintuitive. Compression socks are excellent during the day. But at night, when you're lying down and gravity is no longer pulling blood toward your feet, the compression is no longer necessary. In fact, wearing compression stockings while you sleep can restrict circulation unnecessarily. Take them off before bed and let your venous system work naturally in combination with your chosen sleep position. 3. Keep your bedroom cool. Temperature affects your vascular system directly. When you sleep in a warm room, your blood vessels dilate, which can increase pooling and swelling in the lower extremities. A cooler bedroom, around 65 to 68 degrees Fahrenheit, encourages a mild vasoconstriction of the superficial vessels and better overall vascular tone. It also promotes deeper sleep, which is when the most healing and regeneration takes place. 4. Hydrate, but time it right. Dehydration thickens the blood. Thicker blood is harder to pump, flows more slowly, and is more likely to form clots in sluggish areas like the calf veins. Make sure you are drinking enough water throughout the day, but try to taper off after 7 p.m. so that you're not making multiple trips to the bathroom at night, which disrupts your sleep cycles and eliminates the benefits you're working so hard to achieve. 5. Avoid sitting cross-legged in the evening. Many people settle onto the couch after dinner and sit with one leg crossed over the other for an hour or two before bed. This position compresses the popliteal vessels and restricts venous return in the lower leg, essentially preloading your legs with pooled blood before you ever get to sleep. Try sitting with both feet flat on the floor, or even with your feet slightly elevated on an ottoman in the hours before bed. I want to take a moment before we close, because this is important. Everything I've shared today is genuinely helpful. These positions improve circulation. They reduce swelling. They ease cramping. Practice consistently, they can make a real and lasting difference in how your legs feel. But they are tools for support, not substitutes for medical evaluation. There are certain signs that mean something more serious may be going on, and when you see them, you need to contact your doctor promptly. Please do not assume that changing your sleep position will resolve these. Call your doctor if you notice sudden swelling in one leg only, not both. This is a classic warning sign of deep vein thrombosis, and it is a medical emergency. Do not wait. Leg pain that is persistent, severe, or worsening despite rest and position changes. Skin on your lower leg that is becoming red, warm, hard, or discolored. Sores or ulcers on the legs or feet that are not healing. This can indicate arterial insufficiency. A leg or foot that feels unusually cold or turns bluish-purple. This suggests compromised arterial blood flow and requires urgent attention. Sudden onset of shortness of breath along with leg swelling. This combination can indicate a pulmonary embolism, which is a life-threatening emergency. Your comfort is important. Your safety is essential. Please take those symptoms seriously. All right, my friends, let's bring it all together. Position 1. Legs elevated above the heart. Let gravity do the work for you. Position 2. Left side sleeping with a pillow between the knees. Free up the inferior vena cava and support your heart. Position 3. Modified fetal position. A gentle bend, never a tight curl, to keep those vessels open through the hip and knee. Position 4. Slightly reclined at 30 to 45 degrees. The surprise pick that lowers venous pressure and may be the answer for restless legs, cramps, and reflux all at once. Position 5. Proper back sleeping with support under the knees. The full body aligner that gives your circulatory system the most even, unobstructed environment to do its job. You don't have to do all 5. Start with 1. Try it for a week. Pay attention to how your legs feel in the morning. Your body will give you the feedback you need. Because here's what I've learned in decades of practice. Your body wants to heal. It is constantly working toward better, every single night. Sometimes it just needs the right position to do it. So tonight, choose one of these positions. Set up your pillows. Give your legs what they've been waiting for. If this video helped you, I'd love for you to hit that like button. It helps other people who need this information find it. And if you haven't subscribed yet, please do, and hit the bell so you're notified every time we publish new content here on Healthy Aging America. Most importantly, drop a comment below. Tell me, which position are you going to try tonight? I read every single comment, and I'd love to hear how it goes for you. And if you want to keep going, check out the video right here on your screen. 5 exercises that unclog your leg arteries while sitting. It is the perfect companion to what you just learned. Take care of yourselves. Take care of those legs. I'll see you in the next video.